Zika cases keep multiplying in the city day by day. Are we staring at another health crisis? Today with us we have renowned health journalist Nozia Sayyed. Nozia Sayyed has over 20 years of experience and has bravely reported from field during major health crises such as H1N1, influenza, Ebola, COVID-19 and Zika. Let's know more about Zika virus from this bold and seasoned journalist. Hello and welcome, ma'am.
Yes, hi Anaum.
So, ma'am, to begin with, please help me and the audience understand what is Zika virus.
So firstly, I'm also very new to this virus as I'm myself trying to understand and research more through our expert virologists. So first thing first, Zika is spread through a mosquito named Aedes aegypti, which is also responsible for the spread of dengue and chikungunya. So at present, still, it's under study basically. So I'm just waiting for more details to come out, like what exactly it does and what are the complications, as you earlier raised also the question, what are the complications that it comes with. The first thing that it is said that it is self-limiting, there's nothing to worry about it, but mostly it is threatening for the pregnant women, as if in case it is infected, it is carried by pregnant women, it can affect the fetus. So, the chances are that the, baby is born with malformations, microcephaly and other kind of, problems.
Okay. So, you were saying that the same mosquito that spreads Zika is responsible for spreading dengue and chikungunya as well.
Yes.
So, what differs Zika from dengue and chikungunya?
See, only the test can verify. The PCR tests. And if at all the clinician is smart enough, he'll be able to, ask the patient for, the testing further of this virus. And it is also said that even though it is the same mosquito, but there are the clinical presentations, though similar, like, fever, cough, cold, joint pain and everything. But Zika is said to be a little different. This is only picked up by Dr. Rajesh Kadia, who's an expert into vector-borne, and he's been studying dengue for the last more than 30 years or so. So he told me that Zika symptoms or its classification changes from the third day of the infection. So there's this skin rash which is evident, which is in dengue and chikungunya a little, I think it starts later or probably it is missing. So Zika, it starts from day 3 of the onset of the infection. So that is how one can know or send the samples.
And what are the symptoms of Zika?
So that's what: skin rash, joint pain, fever. Same.
Okay, so same as dengue
and like viral fever, cough, cold.
Okay, and how do you diagnose and what kind of tests are used?
PCR testing. The Zika testing or such testing is only approved and done by NIV, that is National Institute of Virology, and only then the results are approved by the health authorities. Private laboratories are also, even if they do, the result is not approved. Till the NIV says that this is a positive case, this is negative case, the health authorities doesn't count, it as a positive number. That is,
What are the potential breeding grounds?
Indoors, mostly. And as many would know, I'm just trying to guess, that dengue or chikungunya, as in the Aedes aegypti, it's found indoors, basically humid, dark places, and it's a day biters, this mosquito. So to be very careful, and there's no other measure usually. Precautionary measure only includes mosquito repellent or trying to stay away from mosquitoes, be it any. Why should one allow the mosquito to bite also? But anyway, you cannot predict the behavior or nature of the mosquito, so you just have to be aware.
Fresh water,
the breeding can be found in a little dhakkan also, Bisleri bottle, as to so
you were saying that Zika is harmful to pregnant and lactating women, right?
Yes.
So what other
lactating women? No, I'll not say lactating women, but pregnant women, would be mothers.
So what are the potential complications?
As I said, the fetus, it affects the fetus. It can cause neurological problems.
Okay.
Yeah, the child can be born with microcephaly or other malformations.
Okay.
That was, hence they need to be more careful. So they need to get their prenatal tests done. There shouldn't be any panic as such, because of course the gynecologists would help them. So there shouldn't be any panic, but they should avoid going to or travel, to areas where breeding spots are of Zika, in case that
Okay.
is.
And how long does Zika virus stay in a person's body?
See, there are couple of, mode of transmission, like you just pointed out, a very important question. This first is vector borne, of course, and if at all it is the person is infected, that person, if he is sexually active, that person can, transmit. He can become one of the threats for his partners. He can transmit the virus to his partner if at all he is sexually active. So that person infected with Zika, even if he is treated, after the medical intervention is done, that person has to abstain from sex for at least 3 months. This is for the men. And for women, 2 months. For men, the virus can stay in his semen for 3 months. So yeah, that person has to abstain from sex.
So apart from sex and mosquitoes, in what other ways can Zika virus be transmitted?
See, bodily fluids also. It is said, according to one of the CDC reports, it is said that Zika, in people who are sexually active, if they are infected, it can also be transmitted through bodily fluids like vaginal or other, or say breast milk also. Also, if the mother is infected, she can transfer that virus to her kid also, if at all she is lactating, as you said.
Okay.
So yeah, one has to be very careful.
Okay. And are there any treatment or vaccines in place or upcoming to treat this virus?
The problem with Zika virus is that there's no vaccine as such, and this a person infected cannot be isolated also. So there's only one way to prevent it, and that is to stay away from mosquitoes or take care of mosquito bites. That is the only way.
What as a community we can do to prevent this virus?
Keep your surroundings clean. That is what we can do. And also, if at all, be alert that whenever, if we suspect that you are down with fever or anything related to some kind of infection, just be alert and go to your clinician rather than treating yourself with simple paracetamol at home.
Okay.
Yeah.
That is it. Thank you so much, ma'am, for this insightful conversation.
Thank you so much for calling me back.